exhibit. Within this exhibit, it is encouraged that each viewer take in the severity of shell shock, now named PTSD. Please note that the following information touches on the research, diagnosis, treatment, and resources given to British soldiers in World War I that endured shell shock. Please feel free to start the exhibit with the introduction video and grab a map to guide you. I'd like to take this time to dedicate my project to my great-grandfather and grandma. My project was inspired by my great-grandfather, Vernon Warner. He served in World War I and was one of the many cases that experienced shell shock. Here's another photo of him in his Navy class. He's in the third row, third person from the left. He sent this back home to his wife and daughter at the time. So what is shell shock? Shell shock affected over 200,000 men. The term itself was created by a doctor or medical officer named Charles Myers in 1951. Originally, many medical professionals were led to believe that shell shock was a result of a physical injury to the nervous system that was caused by a shell attack or other war exposure. However, with the vast number of cases of shell shock, it was later determined that men did not need to have a physical injury or needed to be directly exposed to shell attacks to be diagnosed with shell shock. For the first time, the world was introduced to a new illness that was mental. The Britain medical system, amongst others, dove headfirst into the understanding, diagnosis, treatments, and provided resources to British soldiers experiencing shell shock from World War I. The following expert is from a podcast. It's a discussion with the former NCO, William Frederick Holmes, and his colleague, and their personal experiences with shell shock during World War I. His language does give a really good insight on what life was like on the battlefield and how many men had to overcome more than just the physical injuries. Originally, Holmes was led to believe that if he had developed shell shock in any shape or form, it was a personal failure of life. For both men, it was hard later on in life to understand what was going on around them besides the war, but the mental effect that the war had on each soldier.
We stayed the night in a building without a roof, and 4 walls, and there I saw my first shell shock case. A fellow lying, crying and shaking like an aspen. It was pitiful, really. I asked somebody what was his trouble. He said it's a shell shock case. He was just waiting to be transported down home. It was a terrible thing. I didn't realize it was as bad as that. Well, I thought it was pretty terrible, but at the time I was still had that adventurous spirit, and I wasn't afraid.
Shell shock would manifest itself in a variety of ways. Clifford Lane of the Hertfordshire Regiment remembered one example.
Every time I went over the top, I was just like, almost every time, somebody went insane. Only one person probably, but I can see them now coming along singing, they're absolutely lost their control of everything. I can remember one man come along with two men, one either side, holding his arms, singing under the old apple tree. He was letting it out, blaring it out, top of his voice. And almost every time I've seen men taken out of the line, but there weren't many. But people being dazed, lying on a parapet or on a fire step, after a bombardment, dazed, that was quite common.
So how did doctors record shell shock, and how did they diagnose it? So to your right, there's a medical case sheet that was found in the National Archives and was written about a 25-year-old male named Jay Milner. He served about 6 years in the military and was stationed in France in August of 1914 and narrowly escaped with his troop. As he was on the run, he was almost captured by the German infantry, and because he was so constantly on the run, he was traveling and hiding for days and nights on end. In 1915, he would be exposed to an explosion that blew him into a car where he was found semi-conscious and was unable to speak when they found him. He was then sent to England where he developed a tremor and severe depression that continuously grew worse. The following medical report writes that he had necrosis, also known as shell shock, due to the impact of the bomb, and that he would need to seek care outside of the military. England Medical would take Milner's medical report and use it to keep track of his progress. After 6 to 8 months of extensive research and observation, his tremor and severe depression were cured. When first cases started to arise and photos such as this one were being sent back to British doctors, including Charles Myers, many didn't know where to begin. Over the next couple of months, would Charles and his associates be able to individually treat British soldiers that encountered shell shock? However, the bigger problem still remained. How were they going to manage the mass casualties of shell shock patients following World War I? He used his knowledge of the French military to create the three main options of treatment. One being the promptness of action, treating it ahead of time or when the symptoms are first occurring. Two, finding a suitable environment, one which the patient can control and is safe, comfortable, and away from any loud sounds. And three, psychotherapeutic measures. Charles and his associates had to argue with the medical system and the military to set up these units that were remote and had minimal combat sounds to treat soldiers. By December of 1916, there were 4 units that they used to treat acute and mild cases, while the more severe cases were sent to the British hospitals for more extensive care. While he and his associates were constantly being criticized for their methods, a conference was being held in 1917 to discuss the improvements that could be made to treat shell shock patients being discharged and placed back into their normal setting. Due to Charles and his associates' efforts, a system was put in place that is still used today within the military, but also the medical field, on how to properly diagnose and treat a shell shock patient. So still more research was conducted. Much of the world still didn't understand that mental trauma was the equivalent to physical trauma and that it was also occurring within these soldiers. The British Army doctors struggled to understand this, so they set up medical observations, and in this photo you can see a soldier that was exposed to shrapnel and had a busted eardrum. They placed him in what was called a sunshine room, which was calm, quiet, colorful, and by placing him in that for a couple hours a day, his PTSD was cured. So there's a whole bunch of theories of what causes shell shock, but these documentations did bring great insight and slim those theories down, as well as symptoms for how to diagnose and treat shell shock. So there's no audio in this video, but this doctor has said a trigger word, the word bomb, and it's resulted in this soldier going into a complete panic and diving for cover. They did this a lot until eventually he became desensitized to it and was cured. So how does this apply to the future? Well, Charles Miles' installment of his system that was used to help treat shell shock was then transformed into the application of injury forms. Injury classification forms were filled out when a patient or soldier was being treated on the battlefield or when the soldier was receiving care for an injury off the battlefield. This form was going to be advised to be revised by the medical system, and while the military did push back, after careful consideration, they did go back and include 2 spaces on the form that allowed for shell shock or other mental disorders such as hallucinations to be added. This revolutionized the studies being conducted on shell shock patients and was able to slim down theories as well as symptoms of shell shock. By World War II, these forms would be vital in the aid and treatment of men dealing with shell shock during battle. I would just like to conclude this, that if anyone you know is suffering from PTSD or yourself, the resources are provided below. Special thanks to our veterans and active duty soldiers. Thank you for coming to my exhibit. Have a nice day.